Welcome to the JOWMA Preventative Health Podcast, hosted by the Jewish Orthodox Women's Medical Association. We provide you with up-to-date information on health topics geared towards the Orthodox Jewish community. This podcast content is provided for informational purposes only and is not intended as medical advice or as a substitute for the medical advice of a physician.
Hi, I'm Brenda Newman, and I'm a medical student at Zucker School of Medicine at Hofstra Northwell. I serve on the JOWMA Pre-Med Committee as co-vice chair, and I guest host the Specialty Spotlight episodes on the JOWMA podcast. The Specialty Spotlight episodes are geared toward anyone who is interested in learning about different medical specialties. In this episode, I will be interviewing Dr. Leiter. Dr. Gila Leiter is an associate clinical professor at Mount Sinai School of Medicine and an attending at Mount Sinai Hospital Department of Gyn and Reproductive Sciences. She has served as president of Mount Sinai's Attending Association and president of its medical board, and continues to serve on their executive committees, as well as many other hospital committees, including the ethics committee. Dr. Leiter practices at Park Avenue Women's Center, caring for multiple generations of women in a comprehensive and holistic practice, and has delivered thousands of babies, including many second-generation births. She sees many patients with complex medical, psychiatric, and surgical problems in pregnancy and evaluates and treats recurrent pregnancy loss, infertility, and abnormal uterine bleeding. Dr. Leiter promotes compassionate care while staying on the cutting edge of women's health and teaches medical students and residents to do the same, both in formal didactics and in clinical practice. She has received many awards, such as Castle Connolly Top Doctors, Exceptional Woman in Medicine, Metro New York Top Doctors, and many more. She has 4 children, is a triathlete, and serves on multiple medical and community advisory boards, and is honored to be interviewed for JOWMA. Thank you for joining us, Dr. Leiter.
Thank you for having me speak to you. It's a great honor, actually. I've only recently joined JOWMA, and it's just been wonderful to see all the people who are interacting and, really sharing the community of learners and growers, and just wonderful.
Yeah, it's a great community to be a part of. And I know as a medical student, I feel very supported being in the community of JOWMA. So I would just like to start off. I usually start off with the same question every podcast episode, but I'm going to start off a little bit differently this time, and I'll do that question as a second thing. So Dr. Leiter's CV is filled with many amazing accomplishments that really inspired me, and I would like to take this opportunity to ask you to talk about some of your accomplishments so that the medical students and pre-medical students listening can also be moved by them.
Yeah. So I think, right, I had told Brenda right on the sort of the top of my mind at this moment is the death of Rabbi Zecharia Wallerstein, who was head of an organization called Ornava, as well as many other things. And I had served for many years as his medical advisor, particularly in the GYN world. I lectured for Ornava on topics such as nutrition and pregnancy preparation, et cetera. But the main thing that I did, and the main reason I feel such a loss with Rabbi Zecharia's passing, is that he was an incredible support for young women who were in trouble, who were, many times cast aside by their family. And the love and the support that he gave young women was just really amazing. And what I did was I was his GYN go-to, gynecological go-to. So a lot of the young women had STDs or pregnancies that were unintended, and many other complex medical problems, rape, incest, I don't want to even go into some of the details, but some of them are pretty hair-raising. But the point I'm making is his example was one of always just not judging, giving love and support. And the young women, many of whom were really in a hard way, just felt it and knew it, and made my my job easier being, able to be part of his team. I did that pro bono and really enjoyed every minute of it, and I'm praying that his work will continue, and I hope to be part of it. I did a lot of things in the hospital, and I was president of the medical board for a while, a couple of year term, president of the attending association. And that was really an interesting piece for me, learning how not just the Department of OBGYN works, but learning about all of the intricacies of how a hospital works, what quality improvement really means. To this day, every week, all of the disasters of the hospital that have to be reported go through the executive committee. So we hear some of the details, and it's always with an idea of how do we grow from this mistake? How do we improve? What can we do differently? And it's really rewarding to be part of this. And I've learned a lot, hopefully helped a lot. And, this is something that I've enjoyed doing. I'm not in an academic track. I'm an associate clinical professor by virtue of teaching, research, but I'm not employed by the hospital. But I did, merit doing this type of administrative leadership roles, and it's given me a lot, as well as hopefully helped the hospital. So it's just two of the things that I can think of offhand. Another organization that I've been involved with, in which I'm sure a lot of the medical students and people listening know about, is Sharsheret. And I really was involved from the moment Rachi Shoretz thought about it. And so I was involved with some of the ideas, ran some conferences on various topics such as sexual health after breast cancer, on genetic screening. And I take care of a lot of patients who've either had breast cancer or are at high risk for it. And so this is something that's very important to me. I've done genetic screening since the 1990s in my office, believe it or not, for BRCA, and now for many other genetic predispositions to cancer. So Sharsheret is a great organization. I've been on their medical advisory board and honored by them, for the work I've done, and maybe also the triathlon that I was asked to do and thought I would never finish, but did. And it's a great organization, and it's been very meaningful for me, the work that I've done with them and the work that is going on. So just a couple of things.
That's great. I'm going to ask about more of more of your accomplishments later, like specific questions. So this is great. I'm going to speak a little bit about, we're going to speak later about the fact that you were part of the medical ethics committee. I have a specific question on that one, but now I just want to ask you, why did you choose a career in medicine, and what characteristics make one a good fit for a career in medicine?
So those are two very different questions. The first question is why I chose a career in medicine. I came from an ultra-Orthodox background. My parents were Holocaust survivors. My father was a Shtibel Rav. And so being a doctor was not, sort of part of what they expected, or, certainly wasn't a typical thing from Beis Yaakov in the years that I went there. And so really from very early on in high school, I sort of decided that this is what I wanted to do. I wanted to take care of women, particularly. And I didn't have the words for it at the time, but really was interested in maybe the mind-body problem, having women be more aware of their body, nutrition, good health, healthy pregnancies. And it was, that was really my goal, or my thought process. In terms of what characteristics makes a good fit for medicine, I think grit, and I think industry, I think passion, commitment, curiosity, eagerness to grow, not being stale, always ready to, morph into something that might be, either what you want to do or learn more about it. I think that the eagerness to grow and to always learn is super important in my mind to be a good physician.
I also went to basic outcome school, so I think that it's a little bit more accepting probably. It's a little bit more seen, but it's still pretty rare. I still get the comment where I tell people I'm in medical school and they're like, "Oh, you're becoming a nurse," and I'm like, "No, I'm becoming a doctor."
Right.
But so can you walk us through a typical day for you as an OB-GYN and tell us why you decided to go into the field of obstetrics and gynecology?
So, typical day for me is I'm either in the office starting around 7:30, or I'm on the labor floor or in the OR, and then midday switch around to either office or OR. So our days are long. My days usually are around 8 to 8, either in office or covering the labor floor, etc. Busy. It's a busy practice, busy running from place to place, always engaging, always interesting. What I love about my daily routine is that it's never the same. The problems are always a little bit different. The couples are always a little bit different. The surgery is always a little bit different. The problems, are can be complex. They can be simple, but there's always, variety. So in 1 hour, I may see a woman who comes in who's postmenopausal and is having problems with incontinence, or I see a young woman who needs birth control or contraception or sexually transmitted disease screen. I see a Hasidic couple who've had 3 cesarean sections and want to know whether they could have a vaginal birth. I can see, just a whole mix and variety of different problems and different concerns, and that makes it exciting. I do a lot of labor floor coverage. So, the nights and weekends can be a little long, especially when, then going right through the week. But it's an exciting field. And, I feel very blessed because one of the things that I really wanted to do in my life is have continuity of care for my patients. And every day I see literally multiple generations of women. And so it's a real blessing. And I think a lot of OBs, act as primary care physicians. They know their patients, they know their families. That's a real bonus of being an obstetrician gynecologist. It also means that you have to be pretty much up on everything. A pregnant woman certainly will come to you and will be asking for primary care. So it's important to stay abreast of all of the new developments in your field, a little out of your field. I try to read the New England Journal as well as my OBGYN journals on a regular basis because I know I'm going to get questions all the time and I want to be, as much up on things as I can be. So a typical day can be long, exciting, never the same, never boring. Like everyone else, the electronic medical record, adds that little extra hours to the day, which, is not always welcome, but, we've learned how to negotiate that better than certainly when we started. Why OBGYN? So, as I said from early on, that was something I thought about. And then when I went to medical school, I'm sure you can relate to this. Every rotation I did in my 3rd year, I wanted to do. I wanted to be a psychiatrist. I wanted to do, surgery. I certainly wanted to do internal medicine. And, at the end of the day, it became hard to decide. And ER medicine was a pretty new field when I was a student, as a separate fellowship or residency and then, fellowship, etc. But I really grappled between ER medicine and OBGYN, and they're very similar in many ways. In other words, quick acting, lots of movement, surgical, internal medicine, sleuthing detective work, quick decision making, being on your feet all the time. So that was the type of practice that appealed to me. And the difference at the end of the day was I wanted to have continuity of care, which I didn't think I could do in an ER. And in fact, that's really been my medical life. It's been, taking care of many generations of women, connections, between families, et cetera. So it sort of has panned out well for me from that regard,
Yeah, I'm about to start my rotations and I'm keeping like an open mind, but I might end up like liking every field and in the same dilemma. I'm actually starting with OB-GYN. So
yay, good. That's exciting.
Can you tell us about your decision to write a book in your career and the challenges that came with that task?
It's an interesting question. So I always loved to read and I always liked to write. And so one of the things that was missing in my life was, little literary pursuits. So I did some editing when I was an attending of, books like how to have a healthy pregnancy and all kinds of other things. And then decided I had a set of twins. And there were really no books at the time that specialized. There was always a few pages or a chapter about twin pregnancy or multiple gestation pregnancy. So I decided there was a lacuna there that I could fill. And that really was the motivation. And, I made a proposal, Random House had accepted it. So it was very exciting. Took a lot more time and effort than I thought it would. At the time I had little kids, et cetera, and a busy, practice. But at the end of the day, it was fun and got translated into, somebody just told me, which I didn't know, into 70 languages.
Oh, wow.
I clearly should have written a update because some of it is now, a little bit old. But really, I think it filled a real niche for a lot of people. So that was an exciting thing for me.
And the next thing, I think this is my favorite question, but you were on the medical ethics committee at Mount Sinai Hospital. What made you decide to take on this role and how did you gain your expertise in medical ethics?
Well, I'm not sure expertise is the word. So when I was president of the medical board, there was a lacuna or a problem because the person who had been doing, I learned almost single-handedly the medical ethics questions and consults was the head of the NICU, Ian Holtzman, and he was getting ready to retire. So that gave me sort of a window into what was going on in the medical ethics. Literally, he and Rosamund Rhodes were like a two-man show. They literally did, fielded all the consults. And it's really quite remarkable. When I went to Ian Holtzman's office to, pick his brain as to who he thought would be a good, co-chair and, future. Looking at the files that he had and just the amount of work that he committed to while being, chairman of the, neonatal ICU. So it wasn't like he had nothing to do, right? And so it really gave me a window into the commitment to medical ethics and to how important it was in the hospital. Right now, the way the medical ethics committee works is that there's multiple people on the committee. Consults come all the time. There's really such a variety of indications for consults and who can call a consult. So it could be an attending, it could be a family member, it could be, the patient themselves. And, we have a whole list of reasons to call, and things like if a patient doesn't have a surrogate, how to negotiate some of the decision making. If the surrogate, chooses something which the attending doesn't agree with, or perhaps will withdraw care when it's not indicated. So these are the kinds of things that ethics, a lot of issues with minors and making decisions with minors. And so there's really a team, and part of what the ethics committee does is educational. So I just got an email from them, which is that they're having a, sort of conference breakfast where people are presenting the cases, et cetera. So it is an on-call system. So there's enough people within each, subgroup so that someone's always available for a consult. And the consults are always complex and they're always interesting and sometimes heart-wrenching, or many times heart-wrenching. How did I get interested? Honestly, my first year at Stern College, which I arrived at 15, with my plastic bag full of my clothes and sheets and didn't know a single person. And it was really a wonderful experience for me. But when I walked in the door, I was lucky enough to have someone tell me, go take this course. And it ended up being a medical ethics course taught by the chairman of the Judaic Studies Department. And we did medical ethics, halachically, and really as evolution of halacha and seeing it over the years. And so that gave me, a lot of understanding about medical ethics from a Jewish perspective, but certainly, certainly there's lots of interesting things, both from a halachic point of view as well as an ethical point of view to learn.
As a physician that specializes in complex medical problems in pregnancy, such as IBD, hypertension, diabetes, depression, and immunological disorders, what advice would you give the patients with these medical conditions that want to get pregnant in the near future?
So that's an excellent question. I think the first important piece of information that I would share with a patient who has any of these problems is get yourself a treatment team. Get yourself a comfortable situation where you can, really rely on your physician or your physician team to understand what your needs are, what your plans are. All too often, patients don't necessarily say, I plan on getting pregnant next year. Am I on the right medication? What do you think about it? Et cetera. And conversely, sometimes some of the maybe rheumatologists or internists don't always think about, a young woman might want to get pregnant next year. How can we make this happen? But getting a treatment, team together for yourself is super important. And really the main concern is being in, a stable condition before you get pregnant. So with any of the issues that you mentioned, IBD, immunological disorders such as lupus, rheumatoid arthritis, and a whole host of other things, including depression, being in a good state, stable state, remission, that's the time to get pregnant. Otherwise, if you're either diagnosed during pregnancy, which does happen, such as IBD, I've diagnosed a few cases during pregnancy, tends to be much rockier courses than if you're in remission in a stable situation. Sometimes it's hard with medical treatment being so disparate, and people move and there's, a lot of flux. It's the beauty of electronic medical records. So at least a lot of records are accessible to a number of providers, but nonetheless, I would encourage anybody who has any complex medical or psychiatric problem to identify someone they're comfortable with who will be treating them throughout the pregnancy and to be in a stable state, when they are trying to conceive, because the pregnancy will be completely different if that's the case, meaning a positive outcome.
What advice would you like to leave the pre-med and medical students listening to this podcast with?
Oh, I have a lot of advice. I think, there's such a plethora information and talk about work-life balance, about burnout, about, all of that. And I think that sometimes that could end up being a little bit of a negative spin. I can say really that keeping passionate about what you do, finding what works for you, prioritizing the important things and sort of letting go of some of the less important things, that's super important, especially if you're trying to negotiate little kids, a full-time busy career, keeping up with your medicine, your friends, et cetera. Maybe your spouse, I think prioritizing, what is important to you and what you love to do. That is what is so critical. Being passionate, being able to say every day, I really enjoy what I do. And, that's what's making me tick. That's what's making me put in the long hours, frustrations, et cetera. Also, I think it's super important to always be eager to learn, never to be static, always grow. No matter how many years of experience, you can always learn, you can always grow. There's always an area which, is new and exciting. And I certainly feel that every single day. And I hope everybody who goes into medicine, takes the opportunity to grow on a regular basis. I also think that community service is very important in whatever matter, you choose to do it. It's wonderful when you have the expertise being a doctor, to find a cause, find something that you can, devote yourself to in the little bit of time that you do have. And, it'll pay back in spades. So.
On behalf of the pre-med committee, I'd like to thank you, Dr. Leiter, for giving us your time and your knowledge this evening. I would also like to remind our audience to please rate and review the JOWMA podcast on iTunes.
Thanks for listening to the JOWMA Preventative Health Podcast. If you've enjoyed this, please rate and review us on Apple Podcasts and share this with your friends. For more information, check out our Instagram at JOWMA_org. Check out our website, www.jowma.org, that's JOWMA.org, or email us at health@jowma.org.